Hi, and thank you for watching On Call for All Kids. Today we're talking about water safety. We'll be getting into the increase of drownings we've seen at Johns Hopkins All Children's Hospital, what could be causing the rise in drownings, and how we can protect our kids through a layered approach. I'm joined by Dr. Patrick Molaroni. He's an emergency medicine physician at Johns Hopkins All Children's. Dr. Molaroni, it's great to see you and talk about this very important topic.
Hi, Ashley.
So here in Florida, we're surrounded by bodies of waters, pool, lakes, you name it. So drowning could be more of a danger for our children. We know that drowning is the number one preventable cause of death for children ages 1 to 4. What are we seeing here at our hospital?
Yeah, that's right. Water submersion injuries can lead to death and permanent brain damage. And during all of the focus on COVID-19, unfortunately, drowning in this area is actually on the rise. We've seen many more admissions to our hospital for drowning over the past 3 months than we actually have for COVID-19. And when we talk about drowning, it's actually what we define that as is a respiratory impairment in a child that's found in the water that can be both fatal and non-fatal. And when we look at the months of March, April, and May, we've actually seen 2 times the number of drownings at our hospital compared to 2019 and compared to 2018. And that part of that that's even more impactful is that the month of May hasn't even ended yet.
Yeah, that's a staggering statistic. So we know that in these warmer states like Florida, it's more common as it is. But are these stay-at-home orders and just having to be more in our households causing this?
Well, it's hard to know, but we do know that most drownings in children 1 to 4 years of age actually happen in their home pool or in a spa at their home. And with children and parents at home more, you'd think that there might be more opportunities for that. When you look at drowning statistics, over 70% of drownings in that younger age actually happen when the child was not supposed to be at the pool. So they weren't supposed to be in the pool or at the pool and actually snuck away from someplace else in the house or in the yard and found their way to the water. So with having stay at home orders and the children at home more often and having the children there 24 hours a day and often the parents working from home, you could think that that would possibly be an increased risk. And we are seeing twice as many episodes as this now. So it's something that we're actually seeing. So as parents and caregivers armed with that information, we need to be very vigilant right now, and we need to take a layered approach to children around water.
Well, let's really dig into that layered approach. Start with the first, topic with that, which is caregiver awareness.
Right, of course. Caregiver awareness, as a parent, being aware of where your child is at all times is very important and even more difficult now, especially with working from home. But we definitely need to be aware. And if you are at the pool with your child, let's say you do know that your child's going to be in the water, that's the time to be away from your cell phone. We got to put the cell phone away. We need to be watching children when they're in the water.
How about measures we should be taking inside of our home?
Yeah, when you have those little toddler age children, pretty much every door in your home should be alarmed, but especially those doors that face a pool. You need a way to know that those doors have been opened with an alarm or something that beeps.
Walk us through the measures we should take outside of our home.
If you're a family who owns a pool, you need to have that thing fenced if you have toddlers at home. And when you think about a pool fence, it has to be fenced on 4 sides. So that does not mean that the sliding door or the door from your backyard opens into the pool. The actual fence needs to have its own door. And when we think about the gate around a fence, it should be a gate that opens outwards so that if a child does get a chair and try and get to the pool, they're down pulling the gate against the chair. And it's another added level of security to try and block them from getting into the pool.
And what should we consider in the actual pool area?
This is really important. When you're done swimming and done playing in the pool, you need to remove all the pool toys. We've got to get rid of those temptations for little children. If they come out and there's a ducky or something else in the pool, they might want to reach for it, reach to play with it, and then they could subsequently fall in the water. So the water needs to be clear of all toys after you're done playing in it.
And finally, how about swim lessons?
Yeah, swim lessons are very, very important. It's one of the best gifts you can give your child is teaching them to swim. And even though many of these are closed down right now because the state's closing down, as we open back up, getting into swim lessons is a good idea. Right now, working with your child more during downtime, trying to teach them to swim is really important. The knowledge of the risks of drowning being on the rise right now is very concerning. And if you know somebody or love somebody who has a young child and a pool at home, please share this post with them because this knowledge and knowing that this is happening more during this time of the stay-at-home orders is really, really important for us to get the word out.
Dr. Maloney, thank you so much. We certainly don't want to see those statistics continue to go up, and we really appreciate and are grateful for you sharing your knowledge. And we thank you all for watching. We hope you continue to stay safe and share this video if you're able to. Comment below here on this video if you have any topics you would like us to look into. And you can also visit our website for more safety tips. It's hopkinsallchildrens.org/safekids. And we'll see you next week.